Hello, welcome back. You're watching WHCC TV live from the World Healthcare Congress here in Washington, D.C. I'm Mabel, Jong. Thank you so much for joining us. Well, we've seen an increase in people traveling overseas for their medical procedures, mostly because of cost and also quality of care. Right now we have in the studio Massimo Manzi, representing Costa Rica, and Dhina Camacho from El Salvador, and they can give us a few more details on what it involves getting medical procedures in another country. Thank you so much for being here, both of you.
Thank you for having us.
Well, first, let me start with you, Dhina. What are the opportunities for medical care in El Salvador?
Well, we offer a destination with a high quality, international high quality, and also a personalized services in El Salvador. We have different specialties like cancer, dental, obesity, and some more. So, and also we offer a combined package with tourism. So I think it's like a vacation.
Oh, okay. So you're killing two birds with one stone, going there for medical procedure and also a holiday.
Yeah.
What about in Costa Rica? Do you see a growing number of companies inquiring about what can be done on the health side in your country?
Yeah, Costa Rica since 1974 is home of a number of medical travelers looking for care, quality care, and obviously savings. So Costa Rica is offering procedures with savings around 70% compared to U.S. costs. So we have a long tradition in receiving patients, mainly from the U.S. We receive every year 70,000 Americans that are looking for care in our country in different specialties. Traditionally, these patients were paying out of pocket, but during the years, we have been expanding different programs. One of those is focused on U.S. corporations. So employers are starting to direct contracting medical services with hospitals in Costa Rica. So the big advantage, obviously, for the companies are the savings, and also employees are saving money because those programs are not including deductible. They are waiving every other fees, including travel expenses for the patient, employee, and for the companion. So it's a win-win situation, and that kind of program are growing.
You mentioned a 70% savings. Can you give me an example of one procedure and how much it would cost on a list price, if you will?
Yes, well, an area that is really important for those kind of programs, like, for example, orthopedics. So a knee replacement is around $50,000, and in the U.S. the average price is over $50,000 to $70,000. So that's one example. In dental, also savings are really big. Dental programs are not necessarily sponsored by employers. These are, for the majority, are out-of-pocket patients, but a dental implant in Costa Rica is around $1,000, $1,200, and the U.S. can be $3,000 to $4,000. So savings are big. Our doctors and dentists, many of them are board certified or members of the different academies, American academies. So the quality of care is the same or at least comparable to what you can get in the U.S., but for a number of reasons related to general costs, related to our healthcare system, how it is structured. So savings are really big in our country.
Significant. Now back to you, Dhina. How the prices that Massimo had mentioned are quite significant. Is that similar in El Salvador?
We have similar prices. In some specialty could be higher or less, but we work in different characteristics and specialties, and we can combine the two countries. So we are trying to offer new options for employers, for Americans, so they can save in healthcare. And also, but yes, the prices are less than here in America.
How do you deal with complications if a patient happens to have something happen to him on the health side that was unexpected?
Okay. Usually, a patient stay in the country 1 week or 2 weeks. So if there is a complication, it's going to happen there. And also the good thing is that our facilities and our doctors are going to take care of the patient until it's fine. And they are trying to solve the problem in there. And they are going to give following to the patient after he come back here. Mm-hmm. So this is not an issue.
Okay.
in this.
Yeah, in Costa Rica, we have a program that is called the Safe Destination for Medical Travelers. So it's a program that has different elements. One of those is compliance with international standards of quality and patient safety. So we require our providers to be internationally certified, either with a joint commission or other deeming authorities of CMS. The other big component is insurance coverage. So by our law, all our providers must have a general liability insurance that in Costa Rica, since malpractice is felony, so the general liability insurance is also covering every damage that is caused or fault either of the hospital or the doctors. The third element is follow-up. We have a network of 210 medical offices throughout the U.S. and Canada where we can provide follow-up to our patients when they come back. And the fourth component is a conflict resolution. So when we, with the other three elements, we didn't achieve to have an agreement with the patient, there is an instance that is managed by the American Chamber of Commerce in Costa Rica where we provide an opportunity to have a conciliation arbitration instance, so trying to solve our eventual conflicts that might arise.
Okay, well, thank you to you both. That's all we have time for, but thank you so much for your time.
Thank you for coming. Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have many more interviews to come. This is WHCC TV.